We know that there is a direct link between insomnia and certain health conditions or diseases that primarily affect the Black community. And when I say diseases or conditions, we're talking about sleep apnea, hypertension or high blood pressure, obesity, potentially diabetes, and then later in life, dementia-related illnesses or even Alzheimer's. Once we get those diagnoses, it's pretty prevalent that if we were to go backwards, we would find that insomnia potentially could be a link to some of those conditions. And once we get that diagnosis, it's very hard to reverse the effects of those diseases or disorders. My name is Dr. Deneen Dean. I'm a licensed clinical psychologist. I specialize in adults with anxiety and depressive disorders. Common symptoms for insomnia would be having trouble falling asleep, waking up frequently, waking up early, feeling tired or unrested throughout the day, potentially not being able to fall asleep at all, waking up and staying up for several hours. There's chronic, and then there's, just situational anxiety, and so it just depends. Race absolutely does have an effect on insomnia. If we think about where Black people are placed, and when we construct race, we think about working class, we think about middle class potentially, and we think about the types of jobs or the types of careers in which, the Black community has had to involve themselves in over the years. We will find that they have had to work longer hours, more manual labor, potentially, where they had to work the same amount of hours to make just as much as their white counterparts. And so, race and class absolutely does impact the amount of sleep that you're actually able to get. We find that psychologically, over time, it could potentially cause you to have anxiety symptoms and even depressive symptoms if, in fact, this is something that has been chronic or is happening more times than not. We find that people's anxiety symptoms and depressive symptoms increase with lack of sleep. So the best treatment, in my opinion, would be for people to track their sleep. Track your sleep daily to see if insomnia is something that's happening frequently or if it's situational. Next would be to have really, really good sleep hygiene. And some people will ask what that is. Sleep hygiene typically is a pattern that you follow every night in the same order and for your brain to recognize the pattern so that your brain can start to make melatonin to prepare you for sleep. We ask people to turn off electronics potentially 3 hours before bed. And then we ask people to, leave the bedroom for specifically sleeping. The advice I would give people would be to limit social media. That potentially has, some pretty damaging effects on our attention and our ability to manage, what we take in. The information is unpredictable. I think that sometimes, we have to sort of shut that down in order for our bodies to have an opportunity to have a break. I would also use the word protection, and that might sound strange in correlation with insomnia, but protecting your sleep is so important. It's not a skill that most of us learn in families or as we're growing up. Having a protected time for sleep and making sure that we do everything in order to make sure that that happens. But protecting our sleep is super important, and we have to be very vigilant around, having time, having space, and making sure that it's a priority, that we protect the time that our body needs to rest.